My name is Olivia Osgood, and for my project I did traditional South African medicine. So in the United States today, the type of medicine we see is known as Western or conventional medicine, and this is the use of pharmacological treatment methods in combination with reliable scientific backing. Now in South Africa there are Western doctors, but it is often seen that there's a ratio of 2,000 traditional healers to one Western doctor. So in South Africa, there are two types of healers. The first is sangomas, which are also known as diviners. So these healers use observation, listening, and experience to create a diagnosis, and they often do this by communicating with ancestors and throwing bones. The second type of healers are inyangas, which are herbalists, and these healers dispense medications, which include bark, seawater, animal and skin parts, herbs, and seawater, and these are used to treat conditions including HIV, AIDS, cancer, sexually transmitted diseases. And it's believed that these remedies not only contain healing abilities, but they also contain spiritual and symbolic significance. Now, health beliefs in South Africa differ significantly from the health beliefs in the United States. They often believe that illness is caused by an imbalance in the body, and in order to return to normal health, you have to find the balance and harmony again. So there are four causes of an imbalance in the body. The first is natural. So an example of this would be mumps, which is it's a congenital disease. The second is animistic, which is an influence of the wind, clouds, rain, and earth on a person, so this would be a common cold. Magic is witchcraft or sorcery, and this is an example would be insanity or a headache, and neglect of the spirits would result in misfortune. So it's believed that by returning harmony to the body, you can do this by using herbal medicine. So for example, white medicines are used to treat against sorcery, while red medicines cleanse the blood. And if animal or plant parts are used, it's believed that characteristics of these are transmitted to the user. So a common example would be the use of crocodile skin, and a crocodile is a water creature, so it resembles cooling off, so it reduces your fever. Now, during the apartheid, there was a significant increase in infant mortality rates and a decreased life expectancy. So for white South Africans, the life expectancy for males was 65 years old, and for females it was 72. And the infant mortality rates was about 15 deaths per 1,000 births. And in comparison, for black South Africans, the life expectancy for men was 36 years old, and for women it was 37. And mortality rates, about 30 to 50% of live births would die by the age of 5. So the bottom chart, the top chart shows infant mortality rates over the years, and the bottom shows two different hospitals during the apartheid. The Coronation is a non-white hospital, and the J.G. Strydom is a white hospital, and you can see a much larger daily occupancy and admission for the non-white hospital. Now, this strongly relates to human rights because when the Freedom Charter was adopted in 1955, it stated that free medical care and hospitalization shall be provided to all, with special care to mothers and young children. And it also stated that orphans and disabled and sick shall be cared for by the state. But it's because of these rights that a lot of people do not have access to health care, because in urban communities, they are often overcrowded, high cost, and there's a lot of people. So because of this, it increased the use of traditional healers. So the part I really tried to focus on in my paper was incorporation of traditional medicine. So there are 4 different systems for incorporation. The first is exclusive, which is where there is exclusively Western medicine with no traditional medicine. And this is highly improbable because they will use traditional medicine anyway. The second is tolerance, which is the current system, and this is where Western medicine is the only system used. However, there is still traditional medicine that isn't prosecuted. The third is inclusive, where they both exist equally and independently. And the fourth one is integrative, where they both combine to create a new system. And we're really trying to push for inclusive and integrative systems. The difficulty is the significantly different views between traditional and Western medicine. Traditional, they believe in disease as an imbalance in the body, and the goal is to fix this imbalance. And in Western, it's a biological causation of an illness, and the goal is to attack this. So I really wanted to focus on an integrated approach to this because both systems have unique approaches to handling health and care. Traditional healers are often trusted by the community, and they treat the patient holistically, and they provide a unique approach to healing. And Western medicine approaches healing and in a completely different way through science, and they have been proven to work repeatedly, their approaches. So integration could result in significantly improved health for all in South Africa. So looking globally, internationally, traditional medicine is becoming more widely accepted. In Africa alone, 80% of communities use some form of traditional medicine, and South Africa just adopted in their most recent drug policy a condition that said there needs to be more investment in traditional medicine. In order to create a integrated system, there needs to be more scientific validity. So this is a positive correlation between the use of herbal and traditional supplements in their use and their outcome. So by having a scientific correlation, Western medicine would have no option but to use these products because they are based off of science. For risk to benefit ratio, there needs to be a higher risk. There needs to be higher benefits and therapeutic effects than risks to using these medications. So the negative effects is why the global community doesn't widely accept these practices, and these can include allergic reactions, toxicity, death sometimes, and a lot of these interact with prescription drugs. And so by having documented benefits that outweigh the risks, Western medicine would be much more likely in investing in an integrated approach. Now in the United States, we have an organization known as the National Center for Complementary and Alternative Medicine, which monitors the use of traditional medicine in the United States. And they do this by scientifically investigating the effectiveness and use of these types of medicine. Now, complementary medicine is the use of a non-mainstream approach in addition to conventional medicine, while alternative medicine is the use of solely traditional medicine. Now, these are split into two different practices. There are mind and body practices, and then there are natural products. So mind and body practices would include yoga, acupuncture, Reiki, massage, while natural products would include vitamins, minerals, probiotics, and herbs. Now, the mind and body practices are more often used for pain management and stress, while the natural products are used for immunity, like you would take vitamin C for a cold, or minerals and vitamins for insufficient intake with your diet. Now, the three highest complementary approaches are natural products, deep breathing, and meditation in the United States. Now at Quinnipiac University, a lot of us will take daily supplements such as calcium, melatonin, and those kinds of things. And yoga is our most common mind and body practice here, which combines meditation, body movement, and those kinds of things. Now the Quinnipiac University nursing program is strongly associated with the use of traditional medicine. Because we are endorsed by the American Holistic Nurses Credentialing Corporation. This means that we look at patients holistically in the same way that South Africans would. So we treat the patient looking at them from a mind, body, emotional, spiritual method. So when we enter a room, and someone strongly believes in the use of South African medicine, we would want to understand the extent and what they do for their health, and if they are taking any herbal supplements that might interact with any practices that we will be doing. And by doing this and being knowledgeable about different forms of traditional medicine, not even with just South Africa, but worldwide, we will know how to provide culturally congruent care, which will allow you to become a more informed global citizen.
Questions? So, how does this, I guess, what communities are more apt in South Africa to use traditional medicine?
I think I didn't see this in research, but this is what I'm thinking, is as we progress in society, the newer generations, as we learned in the film, The Parts Unknown we just watched, they're more apt to using more current methods of treatment and technology. So I'm going to assume that the older generations would be more likely to use this form of traditional medicines, and it would be more in the rural communities than in the city areas, because it's more difficult to have access to healthcare in rural and townships and that kind of place.